Let me talk about quintiles in Latin America, because one of the best way to convince the customer to work in Latin America is to invite them to visit us in any of the countries.
One of the things that the customers like the most in enthusiastic people, not only quintiles, but especially in quintiles, but also investigators and study coordinators. They're like a sponge. They like to learn. We like new things. We like to try new things. And second, as the patient, the access to patients. First of all, we are concentrated on big cities. Just Sao Paulo alone has almost 18 million inhabitants. There are 23 countries in Latin America, and we covered the whole 23 countries, so we can say easily that we have the large presence in the region. So first of all is the size of the population, and second, the diversity of the population. The beauty about Latin America is the geographic spread. From Mexico, that we are close to the equator, and then we have a pretty much steady climate, to Argentina, where we have very fixed season. We can conduct clinical trials in the whole region, and from north to south. In Argentina, for instance, we can do some clinical trials that we cannot do anywhere else, but similar to Europe.
Since 1995, I can see a tenfold increase on the number of trials in Latin America. Customers are now looking to our region as they used to look to North America and Europe.
The infrastructure in Latin America is what surprised the most, because people were expecting, they have a preconception view or ideas of what are the hospitals, etc. But a large, and I would say at least 10 to 20% of our physicians receive some type of training from overseas, whether they move to other countries, and especially it's true in Brazil.
The customers discover that we have very good investigators, a School of Medicine, regulatory agencies, capability in terms of monitoring activities, good results, top recruiters in every clinical research we are participating. So they discovered the value for working in Latin America.
In Latin America, there's a population of 500 million people. 80% of that population is located in the big cities where we are based and our offices are based. This population is eager to have a better access to health coverage, and that's why they are interested in participating in clinical trials. Latin America is spread between the northern and southern hemisphere. This is a great advantage for seasonal studies because it allows us to enroll patients during the whole year. The majority of the population in Latin America is Caucasian, but we do have Black population, American Indians.
You can find Asian people in Brazil, in Peru. You can also find African people, Arabian people.
Recruitment is really fast in Latin America. We have a lot of patients looking for new treatments and opportunities. Patients are looking for clinical trials to receive a better treatment.
We can develop malaria disease study and also dengue, HIV.
We have had several successful experiences. We have conducted a vaccine trial, pediatric trial, and we were able to recruit 1,300 patients in 17 days.
Here in Latin America, teams in the site, they are really committed in enroll and recruit patients in any kind of disease.
We had a study that we could include more than 300 patients in a very short period of recruitment because Latin America started the study in the end of the recruitment period. So it was very good to have this here.
When I joined Quintiles, we might have had 5 or 6 trials running. We currently have completed over 300 studies involving over 3,000 sites, which have recruited over 30,000 patients.
It's amazing the feedback that we receive from the customers from Europe or North America regarding the quality and how the CRAs are managing the workload here.
Even though we can explain that to our customers, when we have them come and see for themselves, they get very impressed.
Our sites have been audited by several authorities, such as FDA, Quintiles Quality Assurance, Global Quintiles Quality Assurance, sponsors, pharmaceutical and biotechnology companies.
In most of the cases, our investigators in Latin America get their degree in Latin America. Then they get their specialization in the residency that lasts approximately 4 years. And then they get their fellowships.
When we need to find investigators, we always look for the key opinion leaders, and we also ask for them to refer another investigator.
We have several trials in myocardial infection and chronic disease, and most of the principal investigators that are conducting these trials are opinion leaders in the world.
We have some private clinics that are dedicated for clinical research. So it's easy to find in these private clinics investigators that have the certifications like ICH, GCP experience.
Nowadays we have almost 50% of our trials are involved with EDC, electronic data capture.
We are conducting several trials using electronic data capture, and this is our future.
If you are thinking to conduct a clinical trial in Latin America, I'd like to invite you to meet with us. So we have the opportunity to arrange pre-submission meeting with authorities to discuss about the strategy or to discuss about the design of some clinical trial. When we have the opportunity to put our customer in front of our authorities and to discuss the needs and the real needs for the conduction of a clinical trial, we obtain a lot of improvement. I will mention a case. In Argentina, the regular time frame is 3 months for approval, and we obtain the approval in 20 days in uremic hemolytic syndrome. That is a disease that is endemic in Argentina and is under the concern of our authorities. We have a strong history. We have more than 12 years of history in Latin America. We were the pioneers in some countries. We were part of the discussion of the new regulation in a lot of countries. The Latin American countries are working together with US under the Pan American Health Organization to help the authorities also to reach only one standard in Latin America. We want to say to our customer that we could manage the whole process in the approval to provide a full solution in Latin America.
The CROs are growing up a lot lately in the last 10 years, especially in Latin America.
We are moving, of course, according to the market, the big countries first, but now we are looking for other opportunities in other Central American countries like Costa Rica, Panama, Honduras, Nicaragua.
When I joined Quintiles, we were 20 employees. We are currently at the Argentina office around 300 employees. We've got 225 CRAs currently, but that number goes up as we speak because we are continuously hiring new CRAs.
And still, our retention rate is more than 85%. So we are growing, but people are staying. We are really talking about global approach.
Quintiles is very focused on our customers.
We can do your trial here. We can deliver what is expected with the same data quality as North America and Europe.
We will find the desired staff, we will train the staff, and we will work on the recruitment patients that you desire.
Latin America has the patience, has the infrastructure, has the technology, has the sites, and has the experience to perform clinical trials.
Quintiles Central Laboratories are very unique. First of all, because we have presence in 2 countries.
And it's very good because we can process the samples in Brazil and also in Argentina. The other countries in Latin America can also send the samples to these laboratories.
That translates into a faster or better recruitment. Normally, the other CROs, they have to ship samples overseas and then cannot be done on Fridays, for instance. So they have less days to enroll patients. While using Quintiles laboratories, they can enroll patients any time of the day and any day, 5 days of the week.
So the cost is less expensive and we can have the results very fast.
And the kits are built in Argentina, which is very good for clients because we can save some costs and we can have kits readily available for the sites.
The central laboratories in Latin America, they use the same standards of testing, they have the same quality control. So all the laboratories in Quintiles have the same standard of operation.
I know what the customer needs from a CRO. Central Lab in the region can offer a lot of advantages in clinical operations